So we're recording now. Okay, so we'll go through the week 7 and 8 notes. I'm covering from last week. Last week we're going to cover infection control and prevention, HIV, TB, and STDs, and then bioterrorism and disaster. Okay, and then this week we're covering home care, community resources, case management, and care of chronic complex illnesses. So we'll go with the notes. You do have some readings in your book. Remember that a lot of readings you have for the last 2 weeks, there's only a couple of full chapters. Okay, there is chapter 41 and 44 from last week, week 7, which is care of the patients with STDs, and 44 is care of the patients with bioterrorism or after bioterrorism attacks. The rest of the chapters are all just specific pages. Okay, so please don't go and read that whole chapter. Community, for example, in our fundamentals book from last week, it says infection control and prevention, page 249 to 258. That's it. Okay, so I only want you to read those pages. Okay, I don't want you to read that whole chapter. Okay. Same with community care. You're assigned 1 page, 949 in your med-surg book. Just read that 1 page. Don't read the whole chapter. Okay. And then this week, there's a lot of different chronic diseases to read about: post-op care, cirrhosis, type 2 diabetes, PAD, CVI, hypertension. There's specific pages to read about each of those in the chapters. That's all I want you to read. Okay? Does everybody understand that? All these different chronic illnesses are in different chapters, but you just have a small number of pages to read with each of those chapters. And then the notes go over and have a nice summary about those. And then when you get the study guide this week for exam 3, it also has a good summary of these chronic illnesses. And these are already chronic diseases that you should have been introduced to in med-surg, right? So hopefully you have some familiarity with it. Okay, so we'll get going with content in a minute. And then we're going to do quiz 5. I'm going to have you guys do quiz 5, and then we'll go over it. And then we're going to spend the rest of the class doing short group presentations of your group project. Very informal. Don't anybody be intimidated. I'm just going to call out each group, and you guys can just talk about your project. Okay, for the rest of us to learn from. Okay. Exam 2 grades were posted over the weekend. I sent out Saturday night, I sent out available times. Every single slot got full this week. Every single slot. So I don't have anybody waiting for a slot. I have filled everything what people have requested. If you do want to request a time to meet, just send me a time towards the end of the week, maybe over the weekend, that you're available. But all the other times everything's filled up. So and that's really great. It's great that people are wanting to reach out and review their exams, talk about the concepts missed, go over test taking strategies. So I'm really, really happy about that. I really enjoyed meeting with students one-on-one and going through their exams individually and see where we went wrong and see how we can improve. Okay. And I'm meeting with all students that have had grades all over the place. A lot of grades below 78, but a lot of grades above 78. So people want to know, students want to know where they got incorrect questions. Okay. So anybody have any questions about that? Okay. Share my screen here. And I'm going to bring up our week 7 notes. Can everybody see that? Yes? Okay, let's talk about disaster management. Why do you think it's important to learn about disaster management in this class? What role do you think the community nurse plays in disaster management?
Yeah, disasters happen all over the place, so families should know how to handle them.
Mhm,
Triage.
mhm, mhm. What are, there's two kinds of disasters, natural disaster and man-made. What are some examples of natural disasters?
Tornado, hurricane, snowstorm, blizzard,
Tsunami,
Mhm, mhm. Great. What about man-made disasters?
war, bomb,
Pollution, fires, water supply contamination. Okay, you have to be able to identify the difference between a man-made and a natural disaster. Okay. So one of the goals of Healthy People 2030 with regards to disasters is one of the objectives is disease mitigation focused on preparing, alerting, and caring for a disaster within a population. Community nurses play a significant role in all disaster preparedness, disaster response, aftercare. Nurses are expected to jump in at any place in the process of a disaster. Okay, one of the biggest issue is communication. So one of the objectives for 2030, Healthy People 2030, is to focuses on risk messages, how to protect the public, what information needs to get out to who, when, how soon, how much information should we provide? Okay. One of the things that you'll be asked about is how do we teach a family to prepare for a disaster? Okay, how do we, and specifically a kid, how do we help them prepare a kid for a disaster? Okay, so we know we want to stock enough food for 3 days.
Make sure, if possible, that the food is non-perishable, canned goods in
Yep.
particular.
Yep, and that's the last part of this. Stock enough food for 3 days, review the kit every 6 months, ensure all members of the family know where the kit's located. Everybody should know how to turn off utilities in the house. And then, as Trent said, we need to review all the supplies, review the supplies in our kit every 6 months to make sure nothing is expired. Okay, so that's a real important part. That's a real good primary intervention strategy in the community that nurses do, is helping them prepare for a disaster. How many of you have ever participated in a mass casualty exercise? Anybody prepare? How many people in their work environment have prepared for, have had drills, disaster drills? Have you done that? What does that all entail?
Most kind of procedures and protocols that will be taken if said disaster occurs.
Mhm.
I mean,
Is
if you
anybody
can think back far enough to when you were a kid and in school, you did
Mhm.
fire drills. That's it's the same thing for most disasters.
Yep. Evacuation drills, fire drills, right? So what is the purpose? What do you think the purpose of a mass casualty exercise is?
So everybody's prepared in case something happens.
Everybody understands their role, responsibilities, who to communicate to, chain of command, command center. The other really important part of a mass casualty drill is to evaluate the response, right? What is the response time? How long does it take everybody to get organized and the command center to get activated? I mean, we know that early responses decrease casualties. What kinds of roles do you think community public health nurses play in different parts of the disaster? What do you think your role would be? Let's say in
Triage.
preparedness. What would your role be in preparedness? We talked about getting a kit ready, but what else can you be doing?
part of it might be part of teaching other people on what needs to take place in different departments or in just your department.
Mhm.
As you said,
Drills. Go ahead.
knowing your roles, knowing your drills, who is ICD, who's incident command, finding out who's going to be tagged first, who's going to be green tags, red tags, yellow tags, black tags. You get your green tags you can possibly get to help you on scene. With other patrons, remove them from the hot zones depending upon the incident at hand, whether it's an explosion, chemicals, whatever the case might be. It's once again, like I said, it's all regulations, protocols, all set to a T.
Okay, excellent. Excellent. Anybody want to add to what Omar said? What might our role be in the actual response? I mean, yes, we may be on the front lines as a first responder, but we also may be in shelters, right? We may be part of evacuations of facilities. We may be assisting families in shelters with medication, assisting with getting supplies for kids, babies.
It sounds like it's going to be a form of incident command where you're sending out, you're delegating tasks to the CNAs to remove people from certain areas to once again, out of hot zones to out of the hot and warm zones to an area that's to a safe zone.
Mhm.
So everybody can be evaluated and assessed, and once again, another form of triage.
Another form of triage, exactly. What about, what roles do you think we play in the post-recovery from a disaster?
We'll definitely be there to provide comfort, especially for anybody that's going through the grieving process.
Mhm.
If we're thinking disasters that are bad enough to kill people.
Mhm. Community resources, being able to access community resources and knowing what's available, being able to work with the federal agencies who come in to help. There's
Safety
a-
education,
Pardon me?
safety education.
Safety education. Mhm. Yep. How not to make the situation worse after a disaster. When can you go home? When can you can't? When can you not go home? How long do you stay in a shelter? Emotional, mental health issues that come from disasters. The community public health nurse has a very, very important role to play in every part of a disaster. You're looked upon that you can jump in at any phase of a disaster, before, during, or after. Okay? There's one federal agency I want to mention. It's called the National Response Framework, the NRF. And I would like for you to know what roles and responsibilities they provide to communities. Okay, certainly we've all heard about FEMA, right? Federal Emergency Management, right? They're obviously going to be involved. Okay, but what's the National Response Framework? Okay, their role is to support the community experiencing a disaster with several things: transportation, temporary housing, medical resources, search and rescue, and firefighting. So you do need to know about the National Response Framework and what services they provide to communities. Okay. Okay, let's jump to infectious disease. We've already covered, can somebody review with the group, what is the epidemiological triangle? We have reviewed this, correct?
Post, let's just
Post,
for the
Changing an
for the
environment.
sake- For the sake of this, I'll just say that you have it. Post, that's you. Agent, that's the bug. Environment, that's where you are and where you're spreading the bug.
Correct. That's exactly right. Did everybody hear that? So give me an example of host. What could some hosts be?
Could be animal or person.
I'm sorry, hold that thought. What is the agent? What could the agent be?
Anthrax?
Strep.
Common
Vi-
flu.
Virus, bacteria, chemical agent, biological agent, right? The flu, COVID. And then the host is, as Michael said, a human or an animal that gets infected. And the environment depends on what kind of environment you're in. And I always use the example of COVID. You know, was it more risky to be in a long-term care facility with lots of elderly people for COVID, or was it less risky to be in a high school classroom?
Classroom.
Why? Why?
I don't think grandpa's getting out quite as much as a high schooler.
Well, but think about the risk factors. That's what I'm trying to get at. The environment the host plays a huge role. Age may play a difference, ethnic background may play a difference, immunological status, overall health, pre-existing conditions. How healthy is the host to be able to take on whatever agent is coming their way? What kind of environment are they in? Are they in a facility? Are they at home? Is it a crowded place? Do they live in a community that is crowded? Do they live out in rural country where there's not a lot of interaction? Okay. So the few things, passive immunity. All right, passive immunity, you need to know the difference between passive and acquired. Okay, passive immunity is your immunity from somebody else, either from mother or IV administered antibodies. So what is the vaccine? What are the vaccines that we all got? What kind of immunity is that?
Acquired.
Right. Acquired immunity to his disease from a previous infection or vaccine. Okay, so that's a difference between passive and acquired. Herd immunity. What's herd immunity? What's herd immunity? That means it's
One that protect you. Oh, sorry.
no, go ahead. Go ahead.
Oh, I was gonna say the one that protect the population
Mhm.
against the disease.
Exactly. Immunity of a population, herd immunity. We talked about the agent. What's virulence? What does that mean? Virulence is the intensity of the disease, which will depend on how severe the disease impacts the host. So virulence is an important word. Toxicity is another important word when we talk about infection control. What is toxicity? The ability to produce a poisonous reaction through a chemical toxin. And then we need to know the difference between a vertical transmission and a horizontal transmission. Vertical transmission is a mother or father to the offspring. And then horizontal is person to person. And then we have some time frames, incubation period, time interval between the invasion of the agent and the time we start to get symptomatic. That's your incubation period. Okay, and what's your communicable period? We always worry, you know, we talk about kids in schools. What's a communicable period? When can other kids get infected? It's the interval in which the infectious agent may be transferred directly or indirectly from an infected person to others. And then the only thing I need you to know about nationally reported diseases are, you don't need to know the list of them, but know that in your locality, in your state, in your county, federally, there are mandated reported communicable diseases. And there's a whole list of those. So as a school nurse, we had an infectious disease book in our clinics that had a list of everything that needs to be reported to the local health department. From pertussis to measles to STDs to the true influenza. So what I want you to know is that there are reportable diseases, and we are required as healthcare providers to report those, whether it's a doctor's office, whether it's a hospital, whether it's a school, whether it's a workplace. We are required to report certain diseases. Okay? Okay, let's talk about bioterrorism. The two areas I want to cover are anthrax and smallpox. And this was on your HESI study guide. Those are the two I want us to know. Okay, what's anthrax? Cutaneous small sores that develop into the skin with a black center. What are some GI symptoms? Or excuse me, skin, small sores that develop into skin ulcers with black centers. What are some GI symptoms of anthrax? Loss of appetite, diarrhea, fever. Respiratory is the big one with anthrax. Flu symptoms, chest pains, shortness of breath.
Anthrax is a bacteria, right?
Mm-hmm. Smallpox is another big one. There's a question on your quiz 5 about smallpox. Well, it's about a bioterrorism agent. You have to pick what it is. Starts with flu-like symptoms and develops into a rash with red spots that become deep pustules, and they actually leave craters.
Do they look like varicella, like the spots that varicella?
So that's the difference. What's the big difference between smallpox and chickenpox? You should have got this from your reading. Where might smallpox show up that varicella doesn't?
On
Smallpox
the
in the
hands
The
and feet.
chicken pox show on the so your feet
Yes.
make the difference, and they like a blister smaller
Yes.
than the smallpox.
But the big difference is that chickenpox will not show up on the soles of your feet. Smallpox will. So whoever said
Yeah.
that, that's great. That's what we need to know. Okay, chickenpox starts with a rash, smaller red dots, turns into small clear blisters. Okay, where smallpox starts out with a rash, red spots, but then they become deep, deep pustules. Okay, and leave craters. Chickenpox does not do that. Okay, what do we want to know about foodborne illness and safety? I always think universal precautions, right? Washing your hands is the safest, easiest way to prevent the spread of bacteria, contaminants. All right, we always want to wash our hands before handling food. Obviously, we
Wash
want
your
to
fruits and vegetables.
Pardon me?
Wash your fruits and vegetables.
Mm-hmm. Mm-hmm. Okay. Separate your raw and cooked food, right? Make sure you're using separate equipment and separate utensils. Thaw frozen food in the refrigerator, not on the countertop. Cook your food thoroughly. Do not eat hamburger, meat rare. Do not use food beyond its expired date. Right? What about waterborne illnesses? Right? We know that contaminants enter water supplies through animal or human fecal contamination. Cholera and Giardia are very common. Right? They're common when there's no drinking water in their house, or their They're having to bathe and prepare food with contaminated water. And then we have the vector-borne illnesses, Lyme disease, Zika virus, Rocky Mountain spotted fever, malaria, all infectious and communicable diseases. HIV. What about HIV? What is it? Bloodborne infection spread through sexual contact, sharing of needles, could be vertically transmitted from breast milk or during pregnancy. Could be transmitted through blood transfusions. After your needle sticks, you're at high risk exposure. Hey, STDs, chlamydia, syphilis, herpes, gonorrhea. High risk, they put you at high risk for HIV due to the traumatized tissue from these STDs. So we know that HIV testing is an antibody testing, but it could have false negatives for up to 3 months. So that's why it's recommended that all HIV testing should be repeated in 3 months. Okay. There are certain kinds of STDs that are bacterial, and there are certain kinds of that are viral. Obviously, bacterial STDs can be treated with antibiotics, but viral cannot be treated. And it becomes just symptom management, right? So chlamydia, gonorrhea, bacterial, both bacterial, spread through sexual contact, treated with antibiotics. All sexual contact should stop until the treatment is completed. All sexual partners for the last 60 days should be contacted, tested, and treated. And one or both of these can be asymptomatic. And for women, can cause PID, pelvic inflammatory disease, potentially lead to infertility, endometriosis, pelvic adhesions, and death if not treated. Syphilis, what's this? Begins with a painless core canker. It moves into your lymph system, causes flu-like symptoms. If not treated with antibiotics in the primary or secondary stages, it definitely can become latent and reactivate later in life, causing severe damage to parts of your body. At that point, it's no longer curable in this stage. The other thing with syphilis too is with pregnant women, right? If a woman has active syphilis and is not treated during her pregnancy, that could present very, very big negative outcomes for the fetus. Herpes, hepatitis, you can go through and read your notes, but there's a section in there about herpes and hepatitis. All these infectious communicable diseases are going to be covered on exam 3. So make sure you have an idea of what each of them are. Bacterial, viral, they treatable, what are they treated with? Okay, we know with hepatitis, it's a viral illness that attacks the liver. There's different kinds of hepatitis. Please know the difference. You guys should have reviewed this in Med-Surg, right? Hepatitis A, hepatitis B, hepatitis C. Right? A is spread through fecal oral contact. B is bloodborne. The high-risk populations are IV drug abusers, people with STDs or multiple sex partners. Hepatitis C is also bloodborne, but this is very dangerous for infants or infected mothers. And then the last one on here is tuberculosis. What do we know about TB? It's a bacterial disease spread through airborne droplets. You guys have gone through this in Med-Surg. Infection is 90%, 5% of the people is latent. Screening, we do a TB test. Who has not had a TB test? For a job, or if you've been symptomatic? Okay, and if the TB test becomes positive, skin test becomes positive, we have to ask the patient if they've had a recent TB skin test, and then we have to arrange for chest x-ray. What's the most important thing for TB when you treat it? You guys should have read this in your readings. What happens when clients in your community are put on medication to treat TB? Do they require home
absolute-
follow-up visits?
Yes, they need to take their medication and in full and don't stop taking it.
Right. Well, what if a family refuses a visit from the community nurse about refuses a visit to check in on them? Is that a problem? Can you just blow that off? No, you cannot. Clients on TB medications are required to be visited by the public nurse, public health nurse, community nurse, to ensure they are taking their medications. It is not optional for clients to refuse. At that point, you need to get the doc involved or whomever, but that is not an option. I know we talk about home visits that are mandated and not mandated. Usually the mandated ones are the most stressful. It's either maybe a client with TB or it's a court-appointed visit, right? But TB medication, treatment, follow-up is a mandated visit. We do know that vaccines are one of the most important effective methods in preventing and controlling communicable diseases. Okay, all those childhood diseases, polio, diphtheria, pertussis, measles, right? Those previously were in epidemic proportions, and now they're under control with routine childhood immunizations. They haven't been eradicated, so kids need to be immunized against them. Okay, we have a federal program that's called No Shots, No School. Okay, they have to be immunized by the time they enter school. We have some vulnerable groups though.
I have a question
yeah.
about that.
Mhm.
I have a family member. We're from Puerto Rico. So in Puerto Rico, they have, I don't know if it's a law or like it's something that if you don't want to immunize your
Yep.
kids, you can't do that.
Yep, I haven't got
But-
to that yet.
well,
Yep.
Oh, sorry.
No, that's okay. It's called
But
it's
they,
called an
like-
exemption.
Okay, because my mom didn't do that to my sister when
Mhm.
she was in Puerto Rico. But
Yep.
when she came to the United States and
Mhm.
she transferred everything, she had to like do all of her immunizations because they were not going to accept the exemption that Puerto Rico accepted.
Oh, interesting. Well, with regards to vaccines, families, I mean, I had families in all my school buildings that did not want to get vaccinated. Here in this country, they're called exemptions. You can do 3 kinds of exemptions, parents can. You can do a medical exemption, that has to come from the doctor. They have certain kinds of diseases that are contraindicated to get immunizations. You can do a religious exemption, which a lot of people tried to do with the COVID vaccine. And then you could do a personal exemption. I just don't want to. I don't believe in them and I just don't want to. Maybe Jehovah's Witness, I believe. That's a religious exemption. So they have to fill out that paperwork here in the state of Colorado. Not only do they have to fill out an exemption paperwork, but if they do, they have to watch a video from the CDC that talks about, doesn't make them feel bad or it's not judgmental. It just talks about the risks of children not being immunized and what you may do if something happens in the school or in the home and somebody comes home with chicken pox and they haven't been immunized against it. So there are going to be families that choose not to vaccinate. Okay, that's okay. We cannot force. We cannot be judgmental. Okay, we just have to make sure they go through the process of whatever your state regulations are. So yes, no shots, no school. However, if you have the exemption, all I can do with families that choose not to be immunized is educate. Continue to remind them that vaccines are the most effective methods of preventing and controlling communicable diseases. Okay? Whether that changes their minds or not, it doesn't matter. But that's my role, is just to continue to educate them on how important it is. But the other thing we have to come up with in the schools or in the community is, what if they are exposed, or a daycare center? What if they are exposed to somebody with measles and they haven't been vaccinated? What do you do? I always came up with a plan in my schools. I always called families that didn't have their kids immunized at the beginning of the year and said, hey, listen, I totally respect your decision. However, we need to have a plan if something comes up in the school, some infectious or communicable disease that your kid's not immunized against, let's say pertussis. We're going to be calling you. You're going to be on our short list. You 8 families that aren't immunized, you're on our short list. We're going to call you to tell you if had an outbreak of pertussis. My recommendation would be that you keep your kid home until this passes. And it's just education and informing them. Does that make sense? But if they're not symptomatic, they don't need to be out of school. Okay. There are some children, particular vulnerable populations, that may be at higher risk for not getting immunized. Right? Many infants and toddlers are the group most vulnerable to potentially contracting these diseases. And they're the ones who do not maybe receive the schedule, because this isn't a one-off. You don't just go in and get the vaccinations. It's a whole schedule. Starts at birth, goes all the way up to kindergarten. Right? Surveys show that inner city kids from minority and ethnic groups are particularly at risk for incomplete immunizations. That's a fact. Parents don't keep the appointments. They move from state to state. They don't carry their immunization cards with them. Right? And as we talked about, children from religious communities whose religion beliefs prohibit immunization. We have to work with those parents as well. And then parents, like I said, who just have philosophical objections to immunizations. Okay. So vaccines, important topic to as you're in the community doing your teaching. HIV, hepatitis, TB, and STDs. Okay. We've covered a lot of it already, but STDs are a major public health challenge. Okay. Bacterial, such as gonorrhea, syphilis, chlamydia. They're cured with antibiotics. We talked about this, right? There is an exception to gonorrhea because there is a newly emerging antibiotic resistant strain of gonorrhea. So you just need to be aware of that. We know that STD that are viruses can't be cured. It's symptom management. We talked about syphilis being transmitted transplacentally, if not treated, is a big problem. Okay, let's jump into surveillance. Surveillance outbreaks. What does that mean? What does that even mean? What is surveillance? I mean, what are we surveilling?
Who's got the bug and what are they doing about the bug?
How's it spreading?
Think of your case study. Oh, maybe that was in the RN. You guys didn't do the case study about the outbreak. So what do you do if you have an outbreak of college students that are all coming to the health clinic with GI? What do you do if there's a restaurant that is reporting several people that are sick? Okay, observation and surveillance are key to monitoring infectious and communicable disease outbreaks. Public health nurses are intimately involved in observation and surveillance. As a school nurse, I was very involved with observation and surveillance. Okay, using our ADPI. System collection, analysis, interpretation, dissemination, monitoring results or monitoring the trends. It's all about ADPI. So think about ADPI in terms of observation and surveillance. Okay, so the purpose, there's two differences. The purpose of observation, we're observing to assess that public health status, identify the trends, set priorities for however we're going to use the resources that we have, and then develop programs for rapid response. Okay, whereas the purpose of surveillance is to reduce morbidity and mortality, right? By preventing or controlling the spread of the disease. Okay, so there's a difference between surveillance and observation, but you'll be involved in both. So with regards to surveillance, surveillance is essential because it helps us with early detection of a disease and implementing interventions to reduce morbidity and mortality. Okay, there's two kinds of surveillance. There's a passive system and an active system. So a passive system relies on healthcare providers to report cases. So that's what I did in the schools. The parent called in and said, went to the doctor yesterday, my kid has pertussis. I know that that's a reportable disease. So I would have to report that to the health department. Many times the doctor's office had already done that as well, but it was just the checks and balances. Okay, so that's a passive system where the health department's relying on people to report, whether it's a long-term care facility, a doctor's office, a hospital, an emergency room, a school, a workplace. That's passive. We are all reporting to them. And then as it moves into the active system, then the health department is the lead investigator. They are communicating with healthcare providers by actively trying to find out, is there more? So for example, a food poisoning. You know, a hospital has 5 people show up with food poisoning. Okay, where did you eat? When did you eat? What did you eat? What did you eat? Then the public health department will put out some kind of an alert to other places. Please let us know if you have any patients that have, come in with food poisoning, you've done your assessment, they've eaten at this restaurant. So that's the active part. Where the passive is reporting of it, the active is now tracking it down. How many people are affected and where are they affected? Or like geographically, right? There's also 2 other types of system. One is a sentinel and one is a syndromic. Okay, in a sentinel system, key health indicators of common diseases are monitored using a sample of cases. And then the syndromic system, that system focuses on real-time data collection using an automated data entry system. Right, so that's an automated system where healthcare providers are entering and public health are entering information into a system. We had a whole syndromic system with COVID. It was all automated. Who's been tested? When have they been tested? When can they go back to school? When can they go back to work? There's also patterns of occurrence that we need to understand. Patterns of occurrence are used when investigating outbreaks. There's all different kinds of outbreaks. Okay, and these are in your notes and it will be in your study guide. You can read about them in your notes, but we have a point source outbreak when everybody's exposed at the same time and everybody gets ill. So maybe a chemical in a train. Everybody gets sick at the same time. And then there's an intermittent outbreak, which is exposure over a period of time. with people getting sick at different times. That could be food poisoning. You know, let's say the lettuce was contaminated and people ate it over 2 days. It's just intermittent. People are going to they were exposed at different times and they're going to get sick at different times. Right? Then there's a mixed outbreak. You can read about that, and a propagated outbreak. So you need to know the difference between the four different patterns of occurrence. There's 4 different kinds of outbreaks. Okay. Then the last part of this is when we're developing community-based programs, the first thing we need to do is a needs assessment. Number 1, needs assessment. Okay. And when we're doing a needs assessment, it is broken out into 3 stages. You're going to have to do your own work on this, your own research on this. There's a pre-active stage, a reactive stage, an inactive, and an interactive. So you may be given a scenario on your exam, right? That when you're conducting your needs assessment, here's what's going on. Here's the task you're doing. What stage is that? Okay. Okay, does anybody have any questions about week 7 notes? Let's jump into week 8 notes. Okay, home care. What's home care? That's what community nursing is all about. Health-related care for individuals and their families in the home setting. Right? Home care also includes home visits by public health nurses and population nurses for primary and secondary prevention. That's all your education that's all the education we do. Right? We try and empower clients and families by providing education, resources, help with a new diagnosis, training, rehabilitation. Think of all the things, you know, again, I've said it over and over again. Community health is an extension of inpatient, whether it's the hospital, long-term care facility, a rehab center, step-down unit. Community nursing is just an extension of that. People go home, and people don't go home not having needs. And that's what we as community nurses do. We pick up wherever they were discharged from, we pick up where that was left off. Case managers. You'll hear case managers, you probably already have, but what is a case manager? Nurses perform in the case management role all the time. It is the coordinator. We're the coordinator of care. Okay, so if you're a discharge case manager in a hospital, you are working with the home health agency, the home health nurse, the oxygen, the home equipment, the Meals on Wheels, whatever it is you need, WIC, whatever you need. That's what case managers do. Okay, they help the client manage the complex needs that they may need. Okay, education, teaching the family, whatever services they're going to need, PT, OT. That's what a case manager does. And then as community health nurses, we have to know what our community resources are. We have to be the bank of knowledge for community resources, right? Community resources are there to help all different kinds of clients in many different roles, helping them manage chronic illnesses, helping them try and reduce their risk to vulnerability, Red Cross, Meals on Wheels, food banks, clothing banks, teen centers, shelters, domestic violence abuse shelters, churches, transportation services. That's our job, to have all that information readily available when we start visiting with patients. Okay? I'm going to have you read the rest of the week 8 notes on your own because it deals with all those complex chronic diseases. And these are all those pages in your med-surg book. Okay, they're all outlined in your notes and they're going to be outlined in the study guide. Okay, so that's your responsibility. I know that you've been introduced to every one of these illnesses in med-surg. Okay, so now what do we do in the community setting? So now they've been discharged from the hospital, what do we do in the community setting? And we go through the ADPI with each of them. Okay, so I'm gonna have you guys do that because I want to go get quiz 5 done and talk about the group projects. Okay, so if you look, the rest of this it's awesome. It breaks down each one and goes to the ADPI with each one. Okay. Questions?
Did you say the next exam might be having a case study on it? No.
I can tell you that the next exam has at least one, if not two questions on every one of those complex chronic diseases.
Oh,
You're
okay,
gonna-
but not like a case study, like a case study to do the questions and answers.
Pardon me?
Oh, I thought you mentioned the next exam, we might have a case study on it. I thought that's what you're saying.
No.
Oh, okay.
The next exam, you will be asked on all of those 7 or 8 chronic diseases that are in your week 8 reading. Okay. In the study
Okay.
guide, you have a very detailed list of information about those chronic diseases in your week 8 notes. I have summarized all of those in a shorter version in your study guide. Okay, does
Okay, thank you.
that make
The
sense?
study guide gonna be,
Yeah, I'm hoping to
sent
get
out
it out.
shortly?
Yeah, I'm hoping to get it out in the next couple of days. All right, because
Sounds
this,
great.
we're covering week 7 and 8 today, and week 9 after next week. Next week is our last week of content. Right?
Yeah.
All right, everybody pull up everybody take your quiz 5. Okay, let's see, it's 1:54. I'm going to do 10 minutes. 10 minutes. So you have to 2:05. We may not get to our group projects until next week, but let's see. And maybe that will be our activity next week. Because quiz 5 is kind of hard. So everybody go take quiz 5. I'm going to mute myself and I will see you in,
I think this is gonna be our last quiz too, right?
this is the last quiz. Yeah.
You want us to take it on our own? You say it's
You're
hard.
taking it on your own. You're taking the quiz on your own. You have 10 minutes and then hit submit, and then we're going to go through it. There's a lot to talk about with quiz 5. It's all clinical judgment. I'll see you in a few minutes. People still working on it? Okay. Okay, a couple more minutes. I don't have a lot of people who've submitted it yet. I only have 4, 5. So if you guys could, if you finished it, if you could submit it, that'd be great.
I submitted, but it's sitting here thinking, so I'm not sure what the problem is.
Oh, no worries. This was a hard one. I thought it was. Everybody getting close? Okay. All right. We go through it? Could everybody hit submit? That's done? Please? All right, let's go through it.
Miss Marble, I'm gonna have to be excused a little bit because there's tornado sirens right now and where I live.
Ew, Well, you
Yeah.
go, who's talking?
Ileshka,
Where are you?
Ohio.
Anybody else? Anybody else need to take cover?
Yeah,
take-
this is,
You go take cover.
yeah,
You-
I'll be right back.
You can turn your Zoom off. Okay, let's go through this. All right, question 1. Oh, wait, I need to share my screen. Okay. All right, question 1. What'd you guys come up with question 1? School nurse notes several children developing a pustular rash on their faces and extremities following several days of fever and malaise. What steps should the nurse take?
Authorities,
What?
notify authorities,
Yeah, why?
because it could be a possible outbreak that could have potential to
Outbreak of
infect more people.
smallpox. Yeah. Yeah. Okay. So those are some of the symptoms of smallpox. Okay. We can assess their vaccine records and all that, but first and foremost, we need to, this is potentially a smallpox outbreak. Okay, question 2. The nurse is caring for an immigrant who is pregnant with her first child. There are no vaccination records available. Which vaccine should be prioritized? This is in your readings.
Rubella.
Why is the answer rubella?
Because the questions already said, there are no vaccine records available. And then because she's pregnant, this is the only one she cannot take it where she is.
That what?
It's the only one she cannot take while she's pregnant.
Okay. Anybody else have anything to add to that?
I was caught between rubella and measles simply because of the MMR vaccine.
Mhm. But think about, she's pregnant.
Right. so-
What vaccines can't she take while she's pregnant? Cannot.
A live virus.
Exactly.
Yeah, she cannot take it.
No, she can take the rubella. Right? But not the other ones. Right? Merlene? Right? I can't, you're on mute. Okay. I just want to make sure you had that. You had a little bit backwards, so I want to make sure you understand that. Okay, the health department is caring for a 16-year-old female with a new diagnosis of gonorrhea. Which education should the nurse provide? What's the correct answer here? Okay, so we know she has gonorrhea. We know she has a bacterial infection. So what are we watching for?
Call
The
to report
pain
this,
and,
call to
fever.
a fever.
I heard pain and fever. What else? What else?
Call to report any pelvic or abdominal pain with fever.
Right. And again, clinical judgment. Why is that the right answer and the other ones are not?
You need to call to report this pain because gonorrhea, you can probably have like you were saying earlier, you can probably if you have it, you're not treated with antibiotics early, you can end up not having any babies or have difficulty to get pregnant. So you have to report if you have any symptoms of that.
Exactly. Exactly. So everybody
I was
understand
trying
my,
to talk earlier. I don't know. I tried to take my computer on mute. I couldn't.
oh, that's okay. That's okay. Does everybody understand why B is the right answer in that? So she has a diagnosis. So now we don't know that she started on antibiotics. They haven't said that yet. So she has a diagnosis. So now we have to make sure that we educate her on reporting any kind of pelvic or abdominal pain or any kind of fever. Right? She's got a bacterial infection. We have to make sure her antibiotics are if they put her on antibiotics, that they're working. Right? Occupational health nurse is caring for a client who just sustained a needle stick injury at work. Which education should the nurse provide regarding HIV testing? We just went through this in class.
Get retested every 3 months.
Every 3
Months.
Why?
because they can be the first time they get poked with the needles and they go test it, the result might not show can be inconclusive. So they need to redo it again in 3 months, 9 months, and 12 months
Okay,
until a year to figure that out.
perfect. Awesome. They say in the first 3 months, they could also be false positives. Right? So good, good, good. So the answer to that, let's see. C. Question 5, the nurse is developing a primary prevention program for TB, primary. Which intervention is appropriate? Remember, we're trying to prevent something before it happens.
Make sure the place ain't crowded. Nobody catches it if somebody
You
does
need
with it.
to try to reduce a crowded population
Right,
to try to prevent it, because more they
exactly.
in a crowded place, one person can probably have it and transmit it to everybody.
Yep. What's A? Primary, secondary, or tertiary?
I think it's more like sign and symptom. They say to teach residents of sign and symptom of the TB, because if they already have it, they need to know the sign and symptom of it. He will be the tertiary.
No, it'll be secondary. Berlin.
Secondary.
Here's
Yeah,
why.
it'll be secondary.
We don't know that they have it yet, but but we know that they live in a homeless shelter and they're at risk for it.
Yeah, it's
You're trying to prevent something. You're trying to early identify who might be at risk. Okay.
Yeah.
Number 6, home health nurse is visiting a client recovering from a hip replacement performed 8 days ago. The client is complaining of calf pain and leg pain. Which nursing intervention is a priority? Important word, priority. What do we need to, what potentially might be going on here?
A blood clot?
Yeah. So what are we going to assess for? What's our first priority
Redness and
assessment?
swelling.
Assess for
Redness.
edema.
Edema, edema.
This is a good example of all the answers that could be right, but then you have to go back to read the question and it says, what's the priority? So right now the priority is to assess the left calf for edema.
Yeah, I
And
kind of
erythema.
jumped to conclusions and went for Renaissance because I thought DVT and possible traveling. But I didn't think, wait, did I even look at the leg?
Right. Trent, we've talked about this.
I'm thinking too much again.
We've talked about jumping to conclusions. Okay, question 7. The home health nurse is caring for a client with chronic peripheral artery disease in both the legs. What education should be included? If you haven't reviewed your notes and you haven't done your reading on PAD, then you may have struggled with this one. What's the answer?
Stop smoking.
Why?
Why it's not B? Because I think you can use a stocking for swelling too, right?
But
Smoking causes
it's-
vasoconstriction. So if
Yeah,
you stop
it's
smoke,
A.
it dilates the blood
Mhm.
vessels and blood flow will increase.
It seems like
Bingo.
any question that has stop smoking as an option, that's usually the answer, it seems.
Good point.
Anything-
Everybody understand why A is the correct answer?
But all of them are good too, right?
Okay, so if all of them are good, well, what do you have to think? What's the best answer?
Yeah, the A is the best answer.
Right.
Just like she said, it's
Yeah.
vasoconstriction if you're smoking.
Right.
But I'm just asking.
Which dietary modifications should be used? So now these are getting into specific quiz questions on those chronic complex conditions. Which dietary modification should be used by a client with COPD?
Rest, because he's going to be tired. It's not hard to exhaust somebody with COPD. So
Right.
even eating can be exhausting for that patient.
Mhm. Removing the oxygen cannula is not going to do any good. Going to cause harm, right? Eating 3 large meals per day, that might be too hard. Right? So resting before starting a meal. Everybody understand why that is the correct answer?
Yes.
Yes.
Okay, let's talk about cirrhosis. The home health nurse is caring for a client with cirrhosis who lives alone. Which intervention is a priority? What things are clients with cirrhosis at risk for?
All risk is going to
All
hurt him
risk.
the most and hurt him
risk.
fastest. So
Say that again?
I said fall risk is going to hurt
Fall
him the
risk, right.
most and it's going to hurt him the fastest. So
Yes. Fall risk, right. Right. That's the most important answer. You could discuss dietary modifications if he has ascites, but is A a better answer than B? Yes. Fatigue, counsel frequent breaks. So first and foremost, it's asking for the priority. So again, another question where all the answers look like, oh, that could work, that could work, that could work. But go back to the question, what did you miss? You missed priority, right? We're not going to be doing any of the other 3 if we don't do a safety assessment or a fall risk, right? If something happens, right? Does that make
you
sense?
can have the best diet in the world, but if you fall and hit your head,
That's right. That's my
that
point.
diet's not going to do much.
Right, right. Okay, question about hypertension. Which food should be avoided by a client with poorly controlled hypertension?
Canned soup,
Why?
No,
because
It's
of
salty.
All the sodium, all the salt. Yeah,
Sodium.
yeah, yeah. Okay.
now are they going to listen to you?
I don't know. I don't know.
I know it's bad for me, but I still eat it.
Yeah. So you guys really have to be mindful of how many do we do? 1, 2, 3, 4, 5, 6. There's 6 complex chronic diseases that you're going to be asked about. Okay. I don't think we had a post-op care. Make sure you read your section on post-op care, 83 through 99 in your med surg book. Okay. I think it's 220, it's 420 now for you guys, 220 for me. I think since we don't have a quiz next week, would anybody be opposed to doing our short group, informal group presentations next week for our activity? Would that be
Yay.
okay with you guys?
Fine by me.
Sounds like a plan.
Okay, all right. We covered a lot of information today. We covered 2 weeks worth, but we got 1 more week of content next week. That's it. That's week 9. Next week is week 9. We'll do our group projects and we'll do our week 9 content. Week 10 is an exam for you guys. And then you jump right into your HESI. So things are cruising right along. I have had a few people turn in their HESI prep that's due next week. And I've actually had 3 or 4 people turn in their vulnerable populations assignments. So getting ahead of the game. How's everybody coming with those 2 assignments? HESI prep should be just about done.
The vulnerable population, I think we just finished it. That's not the one for week 7. We just sent you.
You guys sent me what'd you guys just send me? Infectious disease, correct?
that was the group project that we just did.
Right.
We're talking about the individual project that's due in 2 weeks.
Right, the vulnerable populations where you pick a vulnerable population from your own zip code I don't want the homeless population across the country or across the world. I don't want the teen pregnancy rate across the country. I want teen pregnancy in your community, homeless in your community, vulnerable population in your zip code. Okay, that's what we need. So that is your individual project, and that's your PowerPoint. That's your PowerPoint that's due in week 10.
Professor
Okay,
Moore, one
Yeah.
quick question. When
Yeah.
are you gonna send out the study guides for exam 3?
in the next couple of days.
Okay.
Next couple of days. I had to work on the one with my RN group and get that out. They have an exam next week. So you guys, you be taking exam 3 2 weeks from today. Okay? And again, if anybody wants to sign up, if you haven't, for a study session or review of exam 2 or review of test taking strategies, please sign. Well, there's really, everything's full right now, but at this point, you're going to have to just send me days and times that work towards the end of the week. I maybe Friday, and this could be a weekend. I do reviews all weekend, so we'll do it if we need to. But I have everybody scheduled that wants to be scheduled at this point. Everybody, and I've already met with several students today. So I really encourage you to take advantage of it. Then please look ahead to the reviews for next week. There's 3 reviews next week, Monday, Wednesday, and Friday. Monday is Professor Ford, Wednesday is Professor Kershaw, and Friday is me. Okay, you got 3 opportunities to attend 3 live sessions. Okay. So look ahead. I sent out the schedule in by week 1, week 2 of all the reviews. Okay. Questions? Well, it's good to see everybody. We're done with week 8, at least week 8 lecture. Just try and everybody just try and do your best at time management, at breaking up your classes and making sure you allow for study time with each of the classes. We're getting towards the end here, and I just don't want you to get, I know you're overwhelmed, but I don't want that to interfere with, just prepare for the exam like you have your other ones. If you need some tips or you need how to break out the study guide, come to one of my review sessions or schedule some time with me. Happy to help you. Okay. I'll stay on if anybody has any questions, but I'm done. Good to see everybody. I hope everybody has a good week. And you know how to reach me.
All right. Thank you very much.
Thank you, Professor.
You're welcome. Good to see everybody.
Thank you.
Ms. Marble, is there